Welcome to our Q&A. I have Mirini from PocketRN here, and I'm excited to have a chat with you,
Yeah.
mainly because you hire remote nurses, but also I got a chance to meet you at Health, and that was back in October, I think. Yeah, October,
Mhm.
November.
Yeah. Time is flying, right? Yeah.
But it was so nice to meet you in person, and I knew you'd be so good to have come in and talk about the company and your story and the opportunity for nurses. So thank you for being here.
Thank you. Thank you for inviting me.
Marini, can you tell us a little bit about PocketRN?
So, PocketRN, we like to call ourselves the Nurse for Life company. So, we are a fully remote telehealth platform and we serve patients, mainly aging adults. But our big motto and purpose is to really provide nurse-led support and care for patients, their caregivers, their families, because we know the value of having that nurse in your life, that person who you can go to, who kind of knows you, knows your health history, knows your baseline, and is really there to provide that extra layer of support and understanding of what's happening big picture with that individual, not only with their family, but with their complex web of providers and care teams. And, it can be really daunting to navigate for families. And I feel like nurses are just so perfectly equipped to help partner alongside patients and their families with this, because not only do we have the clinical understanding and even just the experience of working in the healthcare ecosystem, but also we have like that special secret sauce, right? The soft skills of knowing how to like pick up on when they're really struggling or asking the right questions to kind of figure out how to be the best advocate and support for them. So that's what we do. We have a lot of different types of, I would say, partnerships, but which for the nurses, I think it really then ultimately means like different kinds of roles and jobs based on your experience, the patient population that we serve. And so it's been really exciting just to see the company grow over time and continue to grow our network of nurses. But yeah, we have partners that are health systems, we have partners that are smaller rural health system clinics. We have our guide model, which is focused on dementia care. We have some work with remote patient monitoring. We do some work with clinical trials too, with some pharmaceutical companies as well. So there's a lot of different opportunities that we are able to support, which is really exciting.
How long has Pocket and RN been around?
We've been around since 2021. We started out of the Stanford Biodesign program. From there, we evolved into like a true startup. And we did initially a clinical trial out of Stanford with the Advanced Wound Care Clinic. And then over time, we started to expand and start, having partners with other parts of the healthcare industry as well. So yeah, 2021.
Have you been there since the beginning? What do you do? Like, how
Sure.
do you get in?
So I have been there. I think I started about 4 months into the company incorporating. So really early stages. So I joined kind of right before the clinical trial was launching at Stanford and have been with the company since. And so it's been such an amazing journey to see what we've accomplished in a short amount of time. And my job has evolved over time as well. So early days, we were a really small company. So I did a lot of like, for the first time, what I learned, like clinical operations, right? Which for me at the time, making the transition into a startup, didn't really understand what that meant, but it was something that just came very naturally to me, given the work that I had done in primary care and specialty care and hospital-based care as well. And so, yeah, in the early days, I was very much involved in the operations of building out our escalation protocols, our resources, our onboarding and teaching. And over time, started to learn more about kind of HR and credentialing, these things. Now, fast forward to now, we're a much bigger company. And thankfully, we have people who are experts in those different areas. So my job has changed as well. So currently, my title at the company is Chief Nursing Officer, and I work really closely with our clinical operations team, our HR and talent team, our care delivery team. So, our managers and directors and folks who oversee the nurses delivering the care, but also working with we recently launched a lifetime care services team, which is focused on the care coordination, social work, and things like that as well. Because we started to realize that in addition to the nursing care that we support and provide, our patients and families had additional needs that were kind of beyond the scope. And when that social workers were well primed for to help support as well. So yeah, the job has expanded, the team has expanded, but it's been really fun to just see the company grow over the years.
So glad you addressed what went into clinical operations.
Yeah. I know, but it was really funny because, there are people who've done this for a very long time. And I think it's such an important skill. And I think you and I have had conversations too about sometimes these transitions as nurses, when you go from bedside to other roles, you don't always know how your skills transfer to different
Mhm.
types of roles. I was lucky enough that I joined the company at a time where even though I didn't have experience in clinical operations, because I knew enough from my own experience to help us get started, it was a great pivot point for me to be able to kind of dive into that and really learn what that looks like over time. And so, yes, there's definitely a lot of nursing skills that transfer over into other roles because we are always solving problems and making things work as nurses, right? It's just something we naturally do. We're always trying to find the why of like, why is this delayed? Why isn't this working? Why is there confusion? I feel like nurses are such a huge part of that in any health system or health setting I found. So yeah.
I always like that aspect of startups that you could get in and gain a ton of experience because everybody just has to do all the things.
Yes.
And
Yes.
like I have that type of spirit where I do like getting in there, but it is one of those
Exactly.
things that when you're talking to nurses, you're like,
Yeah.
you also have to know the risks of startups.
Sure. Yeah, yeah. I know you wear a lot of hats in the beginning and lots of lessons that you learn along the way. But I do think, especially when you're talking about any sort of healthcare startup, there's so much value in having a nursing voice involved because we see it from so many different angles. We understand the patient experience, we understand the provider experience. We see so much of it at different angles. We are often seeing the operational bottlenecks that happen in real life on the floor in the clinics. And so it's just incredibly valuable to have that nursing voice involved.
And we're seeing that like in a whole new way now with AI implementation, with
Yeah. Oh, yeah.
needing nurses in there sharing and talking and offering their expertise again.
Exactly. Exactly. It's so important.
Okay, so we're going to get into like the nursing specific stuff here in a little bit, but just
Yeah.
out of curiosity, do you know how many people work at PocketRN total, like all?
Altogether. Oh, okay. So we have been going through a phase of rapid growth, which is very exciting. So I would say we're probably close to about 150 to 160 people total and
Okay.
counting. But I was like, there'll probably be someone at Pocket Art who will fact check me and be like, Mirini, you're wrong. But that's what I'm tracking at the moment.
I
Yeah.
did kind of just like throw it at you. I didn't give you a chance to
It's okay. Yeah.
verify that number. I would
Yeah.
probably get caught off guard too. Well, actually, whenever somebody's like, how many beds is the hospital you work at? I'm like, I have no idea. Like, do people just know those things?
I know, right?
Talking about like health tech and all these things, like obviously RPM and other having nurses helping remotely isn't something that other people aren't doing. So
True.
what makes Pocket RN different from what you're seeing out there?
So I think a lot of these existing programs or like use cases, as you might say, in terms of what's out there and available in virtual care is great. I think what sets Pocket RN apart is that all of those different types of programs where we're able to kind of fit into that ecosystem, what we do differently is that we really then leverage that opportunity to show the value of nurses, right? And so we know nurses are so great at triaging, they're great at educating, they're great at kind of flagging changes in conditions or potential complications early on and making an impact on those future outcomes, whether it is through the teaching or the coaching or triaging and things like that. And so that is one thing that we value so much. There's lots of different ways where you can merely check off the box. And that's one of the things we always talk at Pocket Run. We're like, all right, we are not here to just check off boxes, right? Like, sure, this may be all that's required to like bill for this code, but that's just not how we operate, right? And so our nurses and our team, we're very committed to making sure that we are empowering families, supporting them, helping them connect the dots in this really complicated healthcare system that they're in. And so even though we have these programs that are live, we use those as like a leverage point to have those conversations and identify areas where there are gaps or knowledge that they don't have or places where things are just kind of roadblocked and stuck and offer our help and assistance in creating better outcomes and connecting them and increasing their access to care. So I think that's something that is really different. Like we truly are a mission driven company. Even when we talk about our metrics and things like that, we pay attention to what the nurse experience is like. We pay attention to what the patient and caregiver experience is like. As a team, we're all really energized by that. We have like kudos corners and user story places where like we share the wins with everyone. So even our engineers are like hearting and liking and putting emojis on like a really touching story about a family who sent a follow-up email just to say thank you for like someone on our support team who helped them with like a technology issue, right? And so that is something that I think is so different and special about the company, is that no matter what your role or title is, they're very much aware of what our mission is and what we're trying to change and impact in healthcare. And it's invigorating. Like you can feel that energy and passion coming from the team. So that makes work really exciting.
Do you have, because you mentioned sharing wins, which is one of my favorite things, is
Yeah.
being able to celebrate like the good things that happen. Do you
Yeah.
have any that you can share with us?
That's a good question. There's like so many. So I'm trying to think where there's so many good ones. We have like, for example, we've had RPM programs where we have seen like measurable improvements in blood pressure and like intentional weight loss and changes to their diet to like reduce sodium or things like that. And that was really because they were meeting with the nurses regularly about their vitals checks through the remote patient monitoring portal. And we were able to deploy a way to actually review their trends with them. And so the patients were actually seeing real-time data on the improvements that were happening from the changes that they were making. And they developed a relationship, kind of, we say nurse for life model, because when possible, we try to have patients meeting with the same nurses over time to develop that relationship. And that allows for a lot more continuity, even in the kind of coaching that you deliver and follow up on changes that we've committed to make and things like that. And so in those relationships, we've had patients who just appreciate that level of support and accountability and just say, like, I didn't really know what I was signing up for with this remote patient monitoring, but now they're like seeing that benefit for them. Stories like that are obviously such a huge win because you really are utilizing the technology to make like a measurable difference in someone's health. And then we have so many great ones where we have caregivers, especially in our Guide Dementia program, that are just really burdened and exhausted, and our nurses are able to learn about like what their biggest challenges are at home and give them little pieces of advice or tips or tricks or some sort of behavioral tool that they didn't have available to them. And then we hear back from them. They're like, oh my gosh, this made a world of a difference. Like now when my loved one starts wandering looking for their children who are now grown, but they still think they're little, I have tools in my toolbox to like help redirect them in a way that doesn't cause them distress if it doesn't have to, right? And so I think when our nurses are able to provide those kinds of insights, and it actually makes a difference in the life of that caregiver who's facing a lot of challenges, it just makes a world of a difference to hear that we can do something to like lighten that load even a little bit. So those kinds of stories are always like really, really heartwarming ones.
They really are. I mean, especially the dementia support. Like, I don't know if I've heard of that with another nursing company.
Yeah, it's such a tough, like it's such a tough disease. And I think it takes a lot from the family to then adapt to the changes that are happening with their loved one and trying to keep them as safe and independent as possible. There's no like instruction manual on how to do it right. And everyone's, disease course is very different. And so I think that's another reason why nurses are so well positioned for our guide program to be the ones to deliver that care, because they know physiologically and kind of disease trajectory, like what's happening. And they've had some experiences, so they can also provide a lot of teaching on kind of like what are the things you might expect as you start approaching end of life, or even answering questions about, what's the difference between hospice and palliative care? How do you know when it's not safe for them to live alone anymore? There's a lot of questions like that families are trying to navigate on their own, and to have like a trusted voice to help be a part of those conversations, I think goes a really long way.
I want to ask a general question
Yeah.
about virtual nursing now, if you're okay
Yes.
with. And
Yes.
I'm more
Yes.
curious, I'm curious about your opinion on this. What have you seen change in virtual nursing over the last few years? And do you see this being a common role that sticks around for the long term?
Yes, I think what has evolved over time and will continue to change is just the realization that there are so many different let's, for lack of a better word, use cases for virtual nursing. I think early on, it was like kind of limited to a very small box of things that you could do, like in terms of even remote work for nursing, right? So there was like pretty like common to find like utilization review work or sometimes like case management work that's through like an insurance company. With the pandemic, there was definitely a big push to have virtual nurses that were tied to the inpatient teams to help take care of maybe admission and discharge, to take that off the in-person nurse that's on the floor. There's different kind of programs that have evolved over time, but I think more and more, you see things like remote patient monitoring, whether it is with like your typical vitals versus like something like continuous glucose monitors and tracking those trends over time. You see programs like Guide and some other new ones that are coming up that allow for the ability to provide that flexibility to provide this care virtually. I think is also opening up many more doors. Obviously, there's a lot more being done in like the chronic care management space and things like that as well. And I think that's very promising. And that's one thing that we are really excited about because it really does make a difference in terms of access to care, the convenience for families as well. And I will be, from my own experience, because I've also taken care of patients on the platform, from my own experience, you get to see a whole new dimension of a patient when they're home. They're where they're comfortable, they're in their element with their loved ones. And sometimes you just get way more like a bigger picture into like their world versus when they come to you in a clinic and it's on your turf and your terms. When you see them at home, you really get a sense of like who's around them to support them, or the opposite, the lack of support that they have and how isolated and alone they might be. You get to really see that when you're meeting with them regularly. And I do think sometimes patients are more comfortable and more vulnerable and open because they're in their like comfortable space. They're in their jammies. They have their cat on their lap, like they are comfortable. And I think that has really changed the dynamic in terms of the kind of conversations you're able to have when you're meeting with them.
You mentioned a moment ago with all of this how important it was too for the patient to try and keep the same nurse with them.
Mhm. Yes.
Do your nurses, are they full-time, part-time? Like, how do you make sure they are able to keep the caseload of the consistent caseload?
Exactly. So that's one of the things that I'm really excited, one of the most things I'm excited about is, we did a lot of research into the nursing workforce, even early on in PocketRN's life. We were very much aware that the nursing community has struggled, right? Whether it's with turnover or even people just leaving the profession completely. But at the same time, we have this respect and reverence for what nurses do. So we've always been looking at how do we impact that? How do we bring longevity back to nursing? How do we make sure that nurses can have sustainable careers that are rewarding, but also allow for a little bit more balance and flexibility, right? A lot of traditional healthcare roles, it's not that very flexible, right? And so we interviewed a lot of nurses, and one of the biggest things we talked about or we heard from nurses was that, nursing has been hard because there's not a lot of flexibility in the kind of work schedules you can have and things like that. So we used a lot of that feedback we've gotten from the nursing community to really map out what working at PocketRN as a care delivery nurse can look like. So we do have full-time nurses who work full-time. We also have part-time roles and per diem roles as well. And we basically kind of plan out and map out the roles based on the type of work that needs to be done and what situations there needs to be continuity and what situations there might not need to be as much continuity. Our full-time and our part-time nurses, they are able to choose when they're working within our hours of operation, and they get to pick their schedules in advance and plan out the days that they're working. And so they're able to have more flexibility and still know that, oh, I still get to see Mr. Smith next month when I'm due to see him again, because that's the day I'm going to schedule him on a day where I'm working, right? So we kind of keep that continuity. And for our per diem workforce, we have different kind of work and partnerships where it might be more like on demand and triaging and things like that. So if you call us in the middle of the night, chances are, Mirini, your nurse might not be working, but the person who's on call at night is going to have access to all the notes from the conversation they had with your nurse Mirini, last time. And so that's kind of how we're able to structure it so that we can meet nurses where they are, because we know that there's so many other parts of their life than just their work, and being able to offer different types of roles that can fit their schedules and their other commitments, I think has been really meaningful and hopefully is a differentiator for us because that's often pretty hard to find in nursing jobs in traditional settings. So
Yeah, true flexibility while still getting to like keep the people on your schedule that you really enjoy interacting with is something that's really special.
yeah.
I just saw a LinkedIn post, or maybe it was on Threads. I don't know. I'm too online. Uh, but it was a nurse practitioner talking about how they worked too hard and got to this level of professionalism to just be micromanaged so hard and have no flexibility. And
Mhm. Yeah.
I think that's something that a lot of employers miss with nursing.
Yeah, exactly. And I think like what I found is like nurses are such a special breed of people. Like I think everyone that I've worked with, that I've been fortunate enough to work with at PocketRN, they just have such a commitment to their patients, right? And I think that's one thing they really like is that compared to other work they've done, it's so patient focused and they get to have that relationship with them over time. And so it's not like we have to be like big brother about like here we have to make sure you're there. Like they want to be there, they want to make sure that they're available, right? And so even with the flexibility, we found that nurses still figure out how to make it work. Like you can still be part-time and still meet with your regular people because you know when you're working, so you can schedule them next time on a day that you know you're working. But there's another day where like, oh, I got to take my son to his field trip, I volunteer to be their chaperone, then you just make sure that you don't have available appointments that day and then you can still be there, right? And so that kind of flexibility is something is that's pretty hard to find. And so, yeah, I think nurses are just like highly accountable and they find so much value in being able to be that person to their patients and their families. And so we found that at least that's been my experience with the nurses that we've been working with. So it's been so
Love
great.
the way you said that nurses are highly accountable
Yeah.
because we truly are.
Yeah.
And I think that's where nurses get frustrated with the non-bedside at home work sometimes is that they don't feel like they're trusted. Having
Yeah.
somebody who does is
Yeah.
amazing.
Yeah.
You also mentioned you're dropping so many things that I want to comment on. I also don't
Yeah.
want to interrupt you.
No,
I
no,
didn't realize that your company worked 24 hours a day. Your patients
no.
can call in the middle of the night
They
for
can.
support.
Yes, yes. So yes, we have like our guide program. Patients have access to us 24/7. Some of our healthcare system-based partners also have access to our nursing team. So it kind of depends on how that individual has gotten to us and what's involved in the program. But yes, we have that capability, especially when it's going to help with the continuity. It's going to help with just making sure people are accessing the right level of care. You know, that's one thing that I think nurses are really good at figuring out for patients because a lot of people who don't have healthcare backgrounds, they don't know if this is an emergency room visit or this is like I can wait and see how I feel in the morning and try to be seen by my primary care for a same day sick visit. Like sometimes even just having someone walk you through those options goes a long way. Otherwise, at least when I used to work in primary care, sometimes people they just go to the emergency room because that's the only thing that's open, you know?
Yeah, they
So
can't get a hold of anybody.
yeah. And if you're nervous and you're not sure, it's like better be safe than sorry. And so I think that's another great way to like leverage that nursing experience. And then, you know, on the healthcare side of things, it helps reduce cost of care, right? If people are going to the appropriate level of care that they need.
Okay, I want to ask you some more nitty-gritty stuff about the nurse employment and applying and interviewing. Are you ready to shift a little bit?
Yes, yes.
Okay, how many nurses do you employ right now? Hey, I hope you're enjoying this conversation. If you're wondering right now, like how many nurses this company employs, what their application and hiring process looks like, and what the future of hiring looks like, make sure that you are part of either the YouTube membership paid subscribers or you're part of the Nurse Firm membership, and you'll be able to access the rest of this interview in our full director's ad-free cut.